Hi everyone, this is Neil Writers here, consultant audiologist and director of ClearWax. Thank you for joining me in my latest video using the wax scope. And here we have a patient who attended with an occluding dead skin plugs. This is not earwax, it's dead skin keratin. And you're going to watch me in a moment peel layers of dead skin off the eardrum. So if you enjoy the skin peels, particularly off the eardrum, stay tuned for this. So there's a bit of skin now lining the entire ear canal wall. I'm just starting off peeling it from the anterior canal wall, which is the front section. So this is the patient's right ear. In the distance, you can see the eardrum. It is out of focus because we're mainly targeting this skin in this region first. And part of that skin broke away. There's a bit of skin that's inside the speculum, so I'm just going to mop that up first so we get a better view. To peel this dead skin, I'm using the 17 gauge suction probe. I initially used the 14 gauge suction tip to remove that occluding plug of skin, but now I'm reverted to the 17 gauge, which is a smaller diameter. And it's better for when you're suctioning dead skin because you're less likely to get a phenomenon called clarinetting, and that's when you suction dead skin and the skin violently flaps, either at the tip of the suction probe or just at the entrance, and it emits a very loud high frequency squeal that's not only loud for the patient but it can be loud for myself. So with a smaller suction tip you significantly minimize the risk of clarinetting. And of course when you're working close to the eardrum or the ear canal, you rather use a smaller suction tip just in case you do come in contact with the canal or the eardrum. You're going to cause less trauma or discomfort. So I'm going to come back to this piece in a moment. I'm now going to focus on the patient's eardrum so they could already hear significantly better. But you can see this crumpled layer of skin. There's actually multiple layers. So I'm just getting it in focus. I'm going to target the anterior recess here. And I'm just keeping the suction probe there. I want the suction to do the job. Sort of at this stage moving the suction tip because it's coming away. It's best just keeping the suction tip there. And you can see a part of that skin has just flapped back right over the eardrum. It's settled back, so I need to get that piece away. So I was initially going to go to the posterior superior quadrant there, but then I decided just to go more anteriorly because some of this skin is already peeled away. And I'm just going to kiss the surface of the eardrum, and there we go. Now I'm going to have to move the suction tip a bit because that skin is slightly more adhered. The eardrum is fully visible, but you've got some skin at the roof of the ear canal, so I'm just getting that in focus. Just going to peel that down and away, and it does remove some skin from the posterior canal wall, so the back portion of the ear canal. And I'm now going to go back in with the specular, look at the back part of the ear canal and mop up any soft wax skin from here. So this is just at the first bend actually where I'm dilating the ear canal. And then there's a little bit lower down, which is just on the border of the cartilage and bone. So we've got to be a bit more delicate here. Don't want to make contact with the bony part of the ear canal because that's highly sensitive. And I'm just going to peel back. And again, just going to hover over. And I'm just going to mop up a bit of soft wax skin just at the entrance here. So I'm actually angling downwards. So this patient suffers from chronic itchiness and irritation. However, we've been trialing this patient with a topical cream, which will be available shortly. This patient's tried all other alternatives and they really found the cream helped them. So once it's launched, I will provide you some more details with that. So it's going to have a final look at the patient's eardrum. It's going to stretch open their entrance of the ear canal. There's the eardrum. Looks nice and healthy. There's a bit of skin just at the base. I'm going to just peel some of that away. There we are. I'm just going to get that in focus. I managed to get most of this away, but some of it was entering the posterior recess. Not only do you get an anterior recess, sometimes you also get a little crevice at the back of the ear canal near the eardrum. So I'm just going to cut that skin away. So I hope you enjoyed that video, guys. I know if you enjoy your skin peels, you would have. Do stay tuned for the next video. Take care. Bye.